Let me tell you something that took me several years of clinical practice to fully appreciate. In all that time, across thousands of patient consultations, one condition came up again and again more than almost anything else: high blood pressure, hypertension. And the part that still bothers me, even now, is this. Most of the people sitting across from me had no idea they had it, no symptoms, no warning, just a number on a cuff that they had never had checked or had been ignoring for years. After you see that enough times, you start to notice a pattern. And the pattern is not just about high blood pressure itself. It is about the story people tell themselves before they finally come in. They tell themselves they are just stressed at work. They tell themselves the headaches are from too much screen time. They tell themselves the slight shortness of breath when they climb stairs is just because they are a bit out of shape. And for years, sometimes a decade or longer, that story keeps them away from a simple test that could change everything. Here's what that story is actually doing. It is buying time for silent damage to accumulate. In the arteries, in the heart, in the kidneys, in the brain. High blood pressure is the world's leading risk factor for premature death. Not heart disease directly, not cancer, blood pressure. And yet it remains one of the most undertreated, underdiagnosed, misunderstood conditions in medicine. Today I want to change that for you. I have been practicing medicine for over a decade. I have reviewed tens of thousands of patient cases, and I want to walk you through everything I know about high blood pressure, what actually causes it, the real damage it does when untreated, the signs your body might be giving you that you are almost certainly not connecting to this condition, and most importantly, the evidence-based steps that are proven to bring it down, with and without medication. By the end of this video, you are going to understand blood pressure in a way that most adults never do. Not surface level, not just the numbers, the full picture. And I think that understanding alone is going to change how seriously you take this. Let us get into it. Let us start at the very beginning, because I think the confusion around blood pressure starts with the fact that most people do not actually know what it measures. They see two numbers, say 130/80, and they either feel reassured or worried without really understanding what those numbers are telling them about what is happening inside their body. The top number is called systolic pressure. This is the pressure in your arteries at the moment your heart contracts and pushes blood out. The bottom number is called diastolic pressure. This is the pressure in your arteries between heartbeats, when your heart is relaxed and refilling. Both numbers matter, but they matter in different ways and tell you different things about different aspects of cardiovascular health. A healthy blood pressure is generally considered to be below 120/80. Between 120 and 129 systolic is now classified as elevated. Between 130 and 139 is stage 1 hypertension. Above 140 is stage 2 hypertension, and above 180, particularly if it comes with symptoms, is a hypertensive crisis that needs immediate attention. The reason these categories matter is because the risk of cardiovascular events, heart attack, stroke, kidney failure, rises progressively with blood pressure, not all at once when you hit a single threshold. And here is the piece that I think gets lost in those simple categories. High blood pressure causes no pain. It does not set off any alarm in your body. Your arteries are under elevated pressure every single minute of every day, and you feel nothing. The first time many people learn their blood pressure is dangerously high is in an emergency department, after a heart attack, after a stroke, after kidney damage has already occurred. That is why this condition earned the name the silent killer, not as a dramatic metaphor, as an accurate description of exactly how it behaves. Approximately 1.28 billion adults worldwide have hypertension. Fewer than half of them know it. Of those who know, fewer than half are being treated. And of those being treated, fewer than half have their blood pressure under adequate control. Read those numbers again. They are staggering. And they explain why cardiovascular disease remains the #1 cause of death globally, decade after decade. Now, I want to address something that creates a lot of confusion. When people find out they have high blood pressure, the first question is almost always, why? What caused this? And very often the answer they get is not very satisfying. They are told it is primary hypertension, essential hypertension, which essentially means we cannot identify a single cause. And that is true for about 90% of cases. But that does not mean there are no causes. It means the causes are multiple, interacting, and primarily lifestyle-driven. Cause 1. The first and most significant cause is excess sodium in the diet. Sodium, the primary component of table salt, causes your body to retain water. More fluid in the circulatory system means higher pressure against artery walls. The average adult in developed countries consumes roughly 3,400 milligrams of sodium per day. Health guidelines recommend no more than 2,300. Most of that sodium does not come from the salt shaker on your table. It comes from processed foods, restaurant meals, canned goods, and bread. Reducing sodium intake is one of the most reliably effective non-drug interventions for blood pressure. Cause 2. The second cause is arterial stiffness. As we age, and particularly in response to sustained high pressure, chronic inflammation, and oxidative stress, the walls of our arteries lose their elasticity. They become stiffer. A stiffer artery is like a garden hose with reduced flexibility. The pressure inside it is higher for the same volume of fluid. This is why blood pressure tends to rise with age, and it is also why treating it early, before significant stiffening has occurred, is so much more effective. Cause 3. The third cause is what I would call the metabolic cluster, the combination of excess visceral fat, insulin resistance, and chronic inflammation that now affects a very large proportion of adults in their 40s and 50s. Visceral fat in particular is hormonally active. It releases inflammatory signals that directly affect blood vessel function and drive the kidneys to retain more sodium. This is why blood pressure and waist circumference are so tightly correlated, and why weight loss, particularly around the abdomen, reliably reduces blood pressure. Cause 4. Other significant contributors include chronic stress, which drives the sympathetic nervous system and keeps cortisol and adrenaline elevated, both of which raise blood pressure. Alcohol consumption, physical inactivity, poor sleep, and in a smaller number of cases, secondary causes like kidney disease, thyroid dysfunction, or medication side effects. The point is this: for most people, high blood pressure is not a mystery. It is the accumulated result of identifiable, modifiable factors. And that is actually good news, because modifiable means improvable. I said earlier that high blood pressure is silent, and that is largely true. But I want to be more precise, because there are signals, subtle ones, that many people experience for years without ever connecting them to their blood pressure. Let me walk you through the most common ones. Sign 1. The first is a particular type of headache, a dull, throbbing pain at the back of the head that tends to be worst in the morning and improves as the day progresses. This is not the only cause of morning headaches, but in people with uncontrolled hypertension, elevated pressure overnight, when the body's natural dip in blood pressure sometimes does not occur, can cause exactly this pattern. If you have been waking up with headaches at the back of your head more than occasionally, that is a reason to get your blood pressure checked, not just to reach for a painkiller. Sign 2. The second sign is recurrent nosebleeds. Most nosebleeds are caused by dry air, minor trauma, or thin blood vessels near the surface of the nasal lining. But nosebleeds that happen frequently, that are difficult to stop, or that seem to occur without any clear cause should raise a flag. Severely elevated blood pressure can rupture small blood vessels, including those in the nose. It is not a reliable indicator. Most people with high blood pressure never get nosebleeds, but combined with other signs, it is worth noting. Sign 3. The third sign involves the eyes. Your eyes contain a dense network of tiny blood vessels. The retina is actually where clinicians can directly observe the state of your small blood vessels without any invasive procedure. Sustained high blood pressure damages these vessels. In the early stages, this may show up as occasional blurring, visual floaters, or the sense that your vision is not quite as sharp as it was. More seriously, hypertensive retinopathy, damage to the retinal blood vessels, is a direct consequence of uncontrolled blood pressure over time and can lead to permanent visual impairment. Sign 4. The fourth sign is breathlessness, specifically on mild exertion that would not previously have caused it. Walking up a flight of stairs, carrying shopping bags, moving at a slightly faster pace. When your heart is chronically working against elevated arterial pressure, it has to work harder with every single beat. Over time, the heart muscle thickens and stiffens in response, a process called left ventricular hypertrophy. This makes the heart less efficient at filling with blood, which means less oxygen is delivered per beat, which means the body compensates by breathing faster. You feel it as breathlessness. Sign 5. The fifth sign is tinnitus, a persistent ringing, buzzing, or whooshing sound in the ears that has no external source. Tinnitus has many causes, but one of the less commonly known ones is elevated blood pressure. The inner ear is highly sensitive to changes in blood flow. When blood pressure is high or fluctuating significantly, some people experience a pulsatile tinnitus, a rhythmic sound that follows the heartbeat. If you have had unexplained tinnitus, particularly if it is pulsatile, a blood pressure check is a simple, sensible first step. Now, I want to make this very concrete, because I think one of the reasons people do not take blood pressure seriously enough is that the consequences feel abstract. A number goes up, and something bad might happen somewhere in the body at some point in the future. I want to close that gap. Here is what high blood pressure is actually doing, organ by organ, right now, in someone whose pressure is chronically elevated. To your heart. The heart must generate more force with every beat to push blood through arteries at higher pressure. Over years, this causes the left ventricle to thicken, left ventricular hypertrophy. A thickened ventricle is stiffer and less efficient. It is also more prone to arrhythmia. The risk of heart failure, heart attack, and sudden cardiac death all increase progressively with sustained elevated pressure. To your brain, high blood pressure is the leading risk factor for both ischemic stroke, caused by a clot blocking blood flow to the brain, and hemorrhagic stroke, caused by a blood vessel rupturing under pressure. It also accelerates the development of white matter disease and small vessel disease, which are the structural changes underlying vascular dementia. The link between uncontrolled hypertension and cognitive decline in later life is one of the most consistent findings in cardiovascular medicine. To your kidneys. The kidneys filter blood through an intricate network of tiny blood vessels called glomeruli. Sustained high pressure damages these vessels over time, reducing the kidney's ability to filter waste effectively. This creates a vicious cycle. Damaged kidneys retain more sodium, which raises blood pressure further, which damages the kidneys more. Hypertension is one of the leading causes of chronic kidney disease and kidney failure worldwide. To your arteries. High pressure causes the inner lining of blood vessels, the endothelium, to become damaged and inflamed. This is precisely where atherosclerotic plaques begin to form. Those plaques narrow arteries, reduce blood flow, and eventually rupture, triggering heart attacks and strokes. The relationship between blood pressure and atherosclerosis is not incidental. It is causal and dose-dependent. The higher your pressure and the longer it stays elevated, the faster and more extensively this process occurs. Now, the part of this video that I want you to take most seriously, because everything I have said up to now has been the clinical reality of what is happening and why it matters. But this section is what you can actually do about it. These are not guesses. Each of these interventions has robust clinical evidence behind it. Action 1. This is the single highest yield dietary change for blood pressure. Multiple large randomized controlled trials confirm that reducing dietary sodium by 1,000 milligrams per day lowers systolic blood pressure by an average of 5 to 6 millimeters of mercury. That is comparable to starting a blood pressure medication in many cases. The practical key is to focus on processed foods first, not the salt you add at the table, which is a minor contributor for most people. Read labels. Target anything with more than 400 milligrams of sodium per serving. Action 2. The DASH diet, Dietary Approaches to Stop Hypertension, was specifically designed and trialed for blood pressure reduction. Its core principles are simple. Increase potassium-rich foods like leafy greens, tomatoes, beans, and bananas. Increase magnesium-rich foods like nuts, seeds, and whole grains. Increase calcium through dairy or fortified alternatives. Reduce red meat and saturated fat, and significantly reduce sodium. Combined, these dietary changes can lower systolic blood pressure by 8 to 14 millimeters of mercury, a larger effect than most single drug interventions. Action 3. Aerobic exercise. Brisk walking, cycling, swimming, anything that elevates your heart rate into a moderate zone, lowers resting blood pressure by 4 to 9 millimeters of mercury on average with consistent practice. The mechanism involves improved arterial elasticity, reduced peripheral vascular resistance, and better heart efficiency. The frequency matters more than the intensity. 5 30-minute sessions per week consistently outperforms 3 intense sessions in blood pressure outcomes. Start where you are. A 20-minute daily walk is a legitimate and evidence-supported starting point. Action 4. Alcohol has a dose-dependent effect on blood pressure. Light drinking, 1 to 2 units per day, has a modest effect. Regular drinking above 14 units per week raises systolic blood pressure by 5 to 10 millimeters of mercury and significantly increases the risk of treatment-resistant hypertension. If your blood pressure is elevated and you drink regularly, reducing alcohol is one of the most impactful changes you can make. For some people, it normalizes blood pressure without any other intervention. Action 5. For every kilogram of body weight lost, systolic blood pressure falls by approximately 1 millimeters of mercury. That means losing 5 to 10 kilograms, which for many people is entirely achievable, can lower systolic pressure by 5 to 10 millimeters of mercury. The effect is most pronounced when weight loss comes from the abdomen. Waist circumference reduction is a better predictor of blood pressure improvement than scale weight because visceral fat is the metabolically active component driving the inflammatory and hormonal signals that raise pressure. Action 6. Chronic psychological stress keeps the sympathetic nervous system activated. Adrenaline and cortisol elevated, heart rate up, vascular tone increased. This is not a minor effect. Studies on breath-based stress reduction, including device-guided slow breathing at 6 breaths per minute for 15 minutes daily, show reductions in systolic blood pressure of 3 to 5 millimeters of mercury with consistent practice. Meditation, yoga, and structured relaxation techniques show similar results. The mechanism is real. Stress management is not a soft recommendation, it is a clinical one. Action 7. Sleep deprivation raises blood pressure. So does obstructive sleep apnea. In fact, sleep apnea is one of the most common reversible causes of treatment-resistant hypertension. If you snore heavily, wake frequently, or feel unrefreshed despite adequate hours of sleep, a sleep study is warranted. Treating sleep apnea with CPAP therapy reduces blood pressure by an average of 3 to 4 millimeters of mercury, and in cases of severe sleep apnea, the effect can be much larger. Action 8. Potassium and sodium have a counterbalancing relationship in the kidneys. Higher potassium intake promotes sodium excretion, which directly reduces blood pressure. The target is around 4,700 milligrams of potassium per day, a level easily achievable with a diet rich in vegetables, fruits, legumes, and dairy. Specific foods worth increasing: bananas, sweet potatoes, leafy greens, tomato paste, white beans, and yogurt. For most people with normal kidney function, increasing dietary potassium is safe and beneficial. Action 9. Home blood pressure monitoring is one of the most underused tools in hypertension management. Clinic readings are often higher than real-world readings because of what we call white coat hypertension. The anxiety of being in a medical setting elevates the pressure temporarily. A validated home monitor, used consistently morning and evening, gives your doctor far more clinically useful data than occasional clinic measurements. It also gives you immediate feedback on how lifestyle changes are affecting your pressure. A good arm cuff monitor costs very little and is one of the most valuable investments you can make in your long-term health. Action 10. I want to address this directly because there is a lot of resistance to blood pressure medication, even among people who clearly need it. If your blood pressure is consistently above 140/90, and particularly if you have additional cardiovascular risk factors, diabetes, kidney disease, a family history of heart attack or stroke, lifestyle changes alone are unlikely to be sufficient. Medication in that context is not a failure. It is not a crutch. It is a tool that prevents irreversible organ damage while you also work on the lifestyle factors that matter. ACE inhibitors, ARBs, calcium channel blockers, thiazide diuretics, these are well-studied, well-tolerated medications that save lives. Work with your doctor, not around them. I want to leave you with this. The pattern I described at the start of this video, people going years without knowing their blood pressure is elevated, accumulating silent damage the entire time, is not inevitable. It is a choice, made by default, usually out of avoidance or simply not knowing what to pay attention to. You now know. That changes things. Blood pressure is one of the most treatable conditions in medicine. It responds to lifestyle change faster than almost any other cardiovascular risk factor. And treating it early, before the heart thickens, before the arteries stiffen, before the kidneys are damaged, makes an enormous difference to the trajectory of your health over the next 20 years. You have that window right now. Use it. If you found this video useful, please share it with someone who has been ignoring their blood pressure. It could genuinely matter. Subscribe and hit the bell so you do not miss the next video, where I am going to walk you through the 7 early warning signs that your kidneys are quietly failing, another condition that is almost entirely silent until it is serious. I will see you there.